Hey, so we get a lot of questions about hearing aids coming in on social media. So I figure who better to answer than Dr. Kim Doucett from Light E.N.T. Audiology Department. We're going to give you 3 questions, most common questions from social media.
All right.
You ready?
I'm ready. Bring it.
Okay, here they come. So first one is, get this all the time. What is the best hearing aid?
The best hearing aid, there's no such thing. We need to bring you in, evaluate you, review the evaluation, review your lifestyle, your likes, your needs, and discuss which of the 6 manufacturers offer the best product for you. Whether it's a tiny little hearing aid, an over-the-ear hearing aid, and whether you need connectivity, the iPhone apps.
Yes.
And go from there.
Okay, so 6 different manufacturers, and each one of them has subtypes under that.
Yes, sir. 6 major manufacturers with oodles and oodles of little subsidiaries.
Yeah, so I'm sure people get a better result if it can be selected based on them as opposed to some places that all they're offering is really one brand.
Right. Because we're able to work with so many different manufacturers, we have so many different options available to us.
Right.
We can customize and build a hearing aid program specifically for our patients.
And prices are probably also built into that.
Pricing is a big issue for people, so we can look at what's available in their price range, sizes, style, technologies, and make it for them.
Right, great. Okay, got that. So question number 2.
Question number 2.
Here we go. All right. So I get this all the time, okay? Do I really need 2 hearing aids? Is it okay for me just to get 1 hearing aid?
Yes, you really need 2 hearing aids.
2 hearing aids.
If
okay.
there's hearing loss in both ears, you definitely need 2 hearing aids. 2 hearing aids meet together in the brain. They deliver the sound to the brain. The brain learns to use that sound. It works with speech and background, speech and quiet, and localization, the ability to determine where sound is coming from.
When you talk about speech in background noise, what are we talking about?
We're talking about restaurants, we're talking about cocktail parties, we're talking about family gatherings. We're talking about pretty much anything that's not one-on-one speech that's got things going on around.
This makes so much sense because when I'm talking to a patient in the exam room, they always say, I can understand everything you're saying to me. But that's not what real life is like.
That's not realistic. Even when we're home with our spouses, there's a TV going, there's a refrigerator going, there's an air conditioner cutting on and off. There's always sound.
Yeah. Okay, so 2 hearing aids help with that.
2 hearing aids definitely help with those things.
All right. Question number 3. This is a really interesting question, and it comes up. This came in from social media. If I have ringing in my ears and I get hearing aids, is that going to make the ringing louder?
No. Hearing aids amplify what's going on around us. So it tends to mask or cover up or push to the back our internal sound, whether it's a ring, a hiss, a hum, a buzz, a cricket chirp. Doesn't matter. Those hearing aids, because you're hearing better, will push that sound to the back and make it less obtrusive.
So it's the sound that the person is hearing when they talk about ringing, and that's a lousy term because it rarely actually sounds like ringing. That sound is not a real sound that a hearing aid microphone is going to pick up.
Right. That sound is generated inside, whether it's the hair cells in the ear or somewhere in the brain. So the hearing aid doesn't actually ever hear that sound.
Great. And for someone to understand how their tinnitus, their ringing, is going to be helped with their hearing aids, I think is so important for them to get past that and get better.
Correct.
Okay.
Correct.
So, there are a lot of questions with hearing aids. You really need to come in, have a consultation, and it's an opportunity for your own questions to get answered by Dr. Doucett or another one of our audiologists. So we look forward to seeing you.